Good morning. My name is Dr. Brian Cole, and I'm here in Chicago. Welcome to lovely Chicago with par for the course weather for all of us. In the next couple of minutes, I'm going to speak on empowering data-driven medicine. First, I want to thank Matt Catellis from Patient IQ for asking me to share our personal experience at Midwest Orthopedics at Rush. So I'm the managing partner of a large group that's been around for over 30 years. We are a private academic practice, as the residents and fellows say. We're a private academic group. So we have strong academic responsibilities to perform research, but we also have a private practice objective as it relates to collecting outcomes. And I'll share our experience, our journey, if you will, over the last 25 years that I've been there, and where we started and where we are today in using industry partners, software, and a platform to collect outcomes and to also work with patient engagement, as even all the way to the point of reputation management. It's not always intuitively clear that outcomes are important, because historically it has been an economic drain, and it takes an enormous amount of time to actually introduce and implement and integrate an outcomes unit. I remember years ago when we started with outcomes, we had paper forms. I'm in sports medicine, so we would have these forms with all the traditional validated scales, and we would put them together and staple them together and hand them to a patient, and it would be about 20 pages. And then we got a little more sophisticated. We said, what are all the like questions? So we put the like questions in there so they don't have to answer the same thing twice. And all that did was invalidate all the outcomes forms that we're using to begin with, but it made it a little bit better patient experience. But our compliance in the end, our compliance initially was about 30%, but for subsequent follow-up at 3 and 6 months, our compliance was close to zero. And that was even with full-time research assistants. And we felt then that outcomes were important for research, but outcomes now are important for a variety of other reasons that I list here. One, it clearly helps us monitor for the risk of complications during surgery. It helps us monitor the recovery process. In an area that I didn't think was important, now has proven to be very important based upon reporting function. It allows us to engage and share decision-making with our patients, because we have real-time data on clinical problems, real-time outcomes with easy reports that can help us actually talk to a patient and help them understand what to expect. It helps us to measure the success of our care. It helps us to measure our failures. And I think most of us, while we're quite comfortable talking about our successes, it's become increasingly relevant to actually talk about why we fail. And it's also helped us to understand and measure our surgical intervention, and it actually has a role in econometrics in terms of how we deliver care in a cost-effective way. And then serendipitously, it also helps us outcomes to compare us to one another, both locally in our own practice. It helps us do it regionally, and it potentially helps us do it nationally based upon data-driven processes. It also has an important aspect in terms of the economic impact on our practice. Outcomes are not only important just for the sake of doing research anymore, but outcomes are actually important from an economic perspective. Our government payers demand it in a limited way. If you participate in value-driven care or value-based perspectives in any setting, it's going to be required in order to pay to play. The other issue is patient satisfaction. Very difficult to measure patient satisfaction passively, and with poor compliance, we never really get our arms around the patient satisfaction aspects. So we felt it was very important from that perspective. And what we've learned with our new relationship with Patient IQ, I will tell you that we now not only have data on patient satisfaction, but we also have patient engagement throughout the entire journey of the patient, from the time they walk in the door to the time they exit. So, as I've alluded to, it's very difficult to measure patient outcomes. There's a need to integrate from the time the patient makes a phone call, makes an appointment with your practice. There's a need to integrate from the time they hit the front desk, and there's a need to keep it integrated through the entire patient journey. We measure different things across specialties. We're a multi-specialty practice. We have 100 providers. We have every practice specialty represented. Each of us want to collect different bits of information. And then the data that we do collect has to be actionable. In other words, it has to have good reporting function. It has to be instantaneous. It can't require 2 or 3 FTEs to actually get access to that data. We need to be able to do something that's formidable and actionable if we actually are able to collect the data to begin with, which we can now and we couldn't do in the past. So when we talked about the price tag to do it ourselves, this is just one example. Mayo Clinic in neurosurgery alone, it cost them $1.5 million to establish an integrated outcomes program that they said, look, we can do it better than everyone else, and that was just for neurosurgery. I would say that having looked at the ability to build it, that's a cheap price tag. And then the ability to maintain it as things change over time, database change over time, and healthcare changes over time, regulations change over time. This is probably the introductory price to do this alone. It's not really the business that I care to be in. So what about the timeline? So not only is it a cost issue, it's a scale and time issue. I would tell you, if you choose a vendor, whichever vendor you choose, it's something that can actually be activated, executed within 2 months. If you choose a vendor. If you do this in-house, it probably will never happen, but aspirationally, maybe it will happen over 18 to 24 months. So doing this without a vendor, in my opinion, is a non-starter. We were up and running with our initial vendors within 2 months, fully integrated within 6 months. I will tell you that we went through a variety of solutions. As I said, we started with something we attempted to do on our own. It was paper-based. We failed miserably. We got a few patients to fill out surveys. It was no longer validated because we combined surveys. Our follow-up and our compliance was abysmal. We like to collect 6 months, 12 months, 2-year data, all of this, which is very important, and for the reasons I've said, not just for research, but to assure satisfaction, to allow comparisons to our peers, to do it local, nationally, and regionally. So the data we did get was had poor usability. I can tell you the vendors we previously worked with, it was a very big challenge to integrate the office on the front end. There was redundancy in terms of starting the PRO process, patient-reported outcome process on the front end. They had to enter things twice. It was just not something that we ever could integrate out of the gates. Why did we go to Patient IQ? It is very unnerving to switch if you're currently involved with a patient-reported outcomes software and you have that technology. It's unnerving to transition. But I will tell you, once you take a close look at what you currently have, what your expense run is now, and what you don't have in terms of what can be offered, that's when you start to see the light. This is a process, as I mentioned, that really follows the patient journey, right? It is activated before the patient walks in the office. It's something that is integrated at the time they walk in, and you see them at the point of care. And then once the patient has left your practice and is pursuing further care, whether it's rehabilitation or achieving outcomes, it's still part of the process as far as follow-up, and it even extends all the way to and through online reputation. So this particular program that we use with Patient IQ essentially is initiated at the time the patient makes a telephone call. It proactively will provide information in terms of patient educational content and videos that are customized for our practice, and initially collects data that starts to set the stage for patient-reported outcomes. Point two, they come to your office. It allows us to have a cogent conversation that's consensual with the patient, because we actually have actionable data from the 100 patients that preceded them with that exact same problem. So I can have a cogent conversation with the patient as to the risks, what is to be anticipated, that's specific to my center, and then we have the ability to have shared decision making with this patient. These are some of the things that happen with Patient IQ. Evidence-based alerts. We have the ability now to use data to benchmark ourselves to one another, as well as to our peers locally and nationally. It allows us to develop risk scores in terms of what patients can expect downstream. We are now looking at predictive modeling. We get descriptive statistics in terms of what's happening for that particular patient. Patient walks in, I can get that data immediately. It allows us to have inferential statistics going all the way to and through the ability to do research that is publishable with hypothesis testing, and then the ability to perform linear and logistic regressions. Not everyone needs all of this, but this is the capacity of what Patient IQ brings to the table, and we actually engage with almost every aspect of that portfolio. So what are the results to date? We have now over 175,000 patients enrolled. We have a 71% improvement in our scores. We have more than 1 million patient-reported outcomes that have been collected. We are showing improvement in a number of our scores through across service lines. I'll just tell you, probably the most important aspect of this slide is on the top right. Our compliance rate now is 83%. I will, for my own practice, I hire 3 full-time research assistants. My compliance rate in 1 year was 40%, at 2 years was 25% in our previous, with our previous, the previous tools and software that we've used. So now our compliance is 83%, and it doesn't require high touch with an individual. It's essentially been automated completely. This is 6-month post-operative patient-reported outcomes across specialties, just to give you a sense of the number of surgeries enrolled, the assessments that we're using, baseline scores, and then our 6-month reported outcome score and showing percent improvement. This is really basic reporting function, but you can do this in a pathology-specific, CPT-specific, ICD-10-specific fashion. I was never able to do that with the other alternative that we were using. Similarly, we look at satisfaction now. One thing that I'll tell you that we use, so our EHR, we've gone from next gen, we now use Athena and Epic, and I will tell you the ability to collect patient satisfaction data was not present, so we were always layering on software packages on top of what we were currently doing. So the front desk staff was clicking on 3 or 4 different icons to collect everything that I needed for my practice, that my partners need for their practices, including patient satisfaction, which was an outside vendor. So we anticipated significant savings just by getting rid of all these things that were brought on top of our EHR, providing generally one integrated software package, including the ability to do patient satisfaction across the board. What did we save? We saved, I think this actually underestimates our savings, because we were able to save in FTEs. Our savings from our C-level people estimate that we save $525,000 over 3 years. I actually think it's probably less about the immediate savings, and it's more about the fact that we now have compliance that exceeds 75% across the borders, that we hope to continue to achieve upwards of 2 years. We now can compare ourselves to other top-tier organizations, and many of these organizations are in my backyard. So this is a global economy in terms of healthcare. Without outcomes, we can't really compete, but the ability to layer on top various modules, including patient satisfaction, online reputation, and patient engagement on top of the basics, which just allows us to have an integrated platform. To date, we haven't been able to do that with anything else that's out there until we engage with Patient IQ. So thank you for your time. I don't know if we have time for questions. We probably do. If anyone has specific questions. We have 7 minutes, so great. So I'm happy to take any questions.